Dr. Wolski, I would like to talk to you a little bit about injecting hormones, injecting cortisone or that type of stuff. There's lots of theories out there. It being dangerous, it bypassing the body's own ability to produce, and by doing so you put those crutches on and you hurt it more than without doing it. There's also obviously the information out there that apparently it is super expensive and only the Tom Cruises can afford it. Shed some light on that stuff, because apparently you're using it.
Well, you're probably talking about growth hormones. The steroids that we use are cortisone, and that's what we do is use that for cutting down on inflammation. Now, it does have some side effects. If you use it too much, I've seen people like where they had they get an aseptic necrosis of the hips. That's where that's the worst case I've seen from steroids, where their hips, the circulation of their hips stops, and they end up needing hip replacements. I've seen cataracts from them. I've seen people gain a lot of weight from them, but 99% of the time we see a benefit, and especially if we just use it
moderately.
In moderate amounts. For example, we use for a herniated disc, we'll do epidural steroids, and we'll inject it around the nerve that is being pinched by the herniated disc. That cuts down the inflammation and can cut down the pain. So there's a lot of benefits to it, and you're 100% right. There's some risk to these corticosteroids, the cortisone. As far as expense, usually insurance covers these, and if the patient really needs them, we can get them done, and it really doesn't cost the patient that much out of pocket.
So basically, yes, there are some side effects around, but usually it's like if you use too much. Otherwise, just like red wine, I guess, in very moderation, red wine apparently has a very good health factor benefit. But then, of course, if you drink a bottle or two every day, that the health factor may not be outweighing anymore the other bad things which happen to you.
Well, I've got, like my brother, he lives in Russia. Well, he can buy medications in Russia like over the counter. And he was self-medicating himself with cortisone, and he ended up getting diabetes. You just need, and that was my own brother. You just need to be under medical supervision when you use that type of stuff.
Well, if it's any consolation to you, my brother in Austria, when I give him advice on things I make a living at, he doesn't listen to me either. All right. Well, thanks for giving us again very candid information, telling us how it is, because that's really what us patients, us laymen out there need to know. We don't need it sugar-coated. We just need it the way it is. Thanks a lot, Dr. Wolski.
Okay. Have a nice day.